Good morning. I'm Red Schiller, interim chair of family medicine at Mount Sinai and president of academic affairs for the Institute for Family Health. I got a little bit of laryngitis, so forgive me. Um, I am delighted to have one of our graduates, Dr. Dahmer, this morning. He's accomplished so much in his career, and uh, we're really grateful, both given his work and the time zone that he's dealing with because he's out in Arizona. But before we begin today's presentation, I would like to acknowledge this has been a tough week for us at the Institute. After experiencing the death of several dear colleagues earlier this year, we've lost another member of our team, Shaniqua Maxwell Singleton, who's worked as a dedicated and compassionate nurse and colleague at our Harlem location for 16 years and will be greatly missed. I also want to take a moment of silence for Shaniqua, Paula Russell, Teja Abrar, and Barbara McNamara, who we also lost. Again, it's been a tough year with losses of our family, and let's just take a moment. Okay, Matt, can you do the introduction?
Of course. Good morning, everyone. I'm Matt Beruti, the Administrative Director of the Department of Family Medicine at Mount Sinai. We are pleased to welcome Dr. Stephen Dahmer, the Director of the Andrew Weil Center for Integrative Medicine at the University of Arizona. The Weil Center empowers thousands of healthcare practitioners to deliver evidence-based integrative care. In his dual role as director and practicing physician, Dr. Dahmer has pioneered new standards in patient-centered integrative medicine through research, teaching, and clinical practice. Dr. Dahmer earned his medical degree from the University of Wisconsin-Madison and completed his residency in family medicine at the Beth Israel Residency in Urban Family Medicine, hosted at the Institute's 16th Street Family Health Center in Union Square. He completed his fellowship in integrative family medicine at the Institute for Family Health and the University of Arizona Andrew Weil Center. He holds an academic appointment at the Icahn School of Medicine at Mount Sinai and the University of Arizona. His research focuses on uncovering the real-world outcomes of integrative therapies and healing potential of medicinal plants, driving forward a vision of healthcare centered on whole person health that nurtures and inspires both practitioners and patients. He is triple board certified in family, integrative, and lifestyle medicine. And we ask everyone attending the webinar today to please complete the survey at the end of the presentation. You can find a link to our survey in the chat or using the QR code that you see for two of our colleagues on the call today. Dr. Dahmer, thank you.
Absolutely. Thank you. I think I'll start just by saying, condolences to all of you. I really feel for a loss of a teammate, and I just want to say that before we start. I also want to give a very heartfelt thanks to Dr. Schiller for the invitation to share some of the work that we do at the Andrew Weil Center for Integrative Medicine. Dr. Schiller has been an inspiration and a mentor, along with so many others at IFH, Dr. Ben Kliegler, which for me, this is where it all started. I wouldn't be here today without all of you, and I appreciate that. So I'll start by just saying this isn't mood lighting. It's very early here in Arizona, so the sun has not yet come up. But the title of the talk that I put together today is From Systems to Self, Practical Integrative Medicine for Whole Person Care. I don't have any conflicts of interest to disclose, and I jump right into it. I think one of the things I've always loved about family medicine, reinforced by integrative medicine, is as much as possible, we try to practice what we preach. To practice what I preach means that when I wake up every morning, there is a purpose in the work that I do, and I look for reasons for that purpose. And of course, service, right, is what drives most of us, and the ability to support others in challenging times. When I go beyond that, one of the things I've identified that helps me the most is the quintuple aim. The quintuple aim really looks at optimizing patient experience, population health, reducing cost, care team well-being, and health equity. And if we take these apart a bit, right, and here's some literature. We all can interpret literature in different ways, but I picked some of the research, some of the stats that support some of these areas. Patient experience, and some of our patients may not agree with this at all times, but it's actually one of the areas of the quintuple aim that we're probably doing the best. We're looking at at least a steady, if not slight, trend upward in some of the areas, including medical practice, in the likelihood to recommend, speaking to the patient experience that we offer. This is directly from the 2024 Press Ganey report. As we delve into the quintuple aim a little bit further and look at data points like population health, we're not doing so well. 60% of us with chronic illness, 40% two or more diseases. Childhood obesity is 4 times what it has been in the last 40 years. Chronic disease is really leading with that 6 out of 10, as I mentioned before. Compared to 9 other high-income countries, we rank last in life expectancy, nearly 4 years shorter than the 10-country average. Last in preventable and treatable mortality, last in overall population health outcomes. We look at number 3, reducing costs. This is really sick care. If we call it what it is, we're spending over $12,000 per person, spending the most, and yet our health numbers don't reflect this price that we're paying. 90% of the $4.5 trillion on healthcare, again, specific to chronic illness and mental health condition. And I'm preaching to the choir here in terms of care team well-being. I wear an additional hat at the University of Arizona College of Medicine, Tucson, as the Assistant Dean of Wellness. This is front and center for all of us, with 45% of physicians reporting at least one symptom of burnout. Those groups at highest risk: women, physicians, primary care, emergency medicine, and physicians in training. And we all know what burnout is linked to. And the last one, health equity. And again, this is what I've always appreciated about our work at IFH. We see this front and center. And I won't preach to the choir about the dismal effect that we're having here and how we need to do better. But Black low income is the highest for health, Latino, Hispanic low income, limited access, depression, anxiety increasing in all. Wow, what a depressing lecture from Dr. Dahmer here early in the morning. This is not the goal of my lecture, but I look at this data that actually has fueled integrative medicine for decades. The story goes, and I recall back in 2006 when I first started, this was very fringe. Dr. Weil started on campus here in the University of Arizona in a trailer off campus because it just was something that wasn't accepted. But this data allows us to take a step back and to really offer some critical thinking to the work that we do on a big picture. It also allows us to maybe hold space in paradox. I'm enthralled with modern medicine. I think it's absolutely remarkable, the things that we can do today, but that doesn't mean it has a solution for everything. And this is the why, which has driven me for decades in integrative medicine, is I truly believe that despite investing trillions and these stunning, amazing breakthroughs that we all celebrate, our system is failing to achieve 4 out of 5 pillars because specialized innovation alone is not going to be enough without whole person care and equitable transformation. The reductionist approaches are insufficient to fully understand complex human beings and what health is for all of us. And I reflect even on my own training, and I'm very grateful for my training. But what I have in an ICD-10 code book are 69,000 codes for diseases. And I challenge you, look up health the next time you're applying an ICD-10 code to your patient that you're seeing. And I've done this back to my days on 16th Street. The best I can find is health counsel that I try to put on almost every patient to reflect that we're not just speaking to disease, because our traditional focus has always been diagnosing and treating disease, acute problem consultations. We neglect resilience promotion. There's much less on prevention, even less on wellness. And we often see health as an absence of disease. We're reactive in our funding and our policies in health related to wellness. We marginalize lifestyle, even though it's front and center in almost all of our guidelines. We oftentimes skip over it. We have limited wellness true measurement, and emphasis and time is just not allotted. And I'm well aware of the barriers that we face to addressing some of these things in the time we're given with patients. But what we're calling for in integrative medicine and have been calling for decades, and we're getting more ears to listen, the more that we grow, the more that we offer this message is a shift towards whole person care, where we integrate lifestyle, community, and environment into the work that we do, where we address mental, social, spiritual factors. I realize again, IFH is ahead of the curve in this, but we still have a long ways to go. And we emphasize proactive health promotion. This is not just the colonoscopy or the vaccines, is to truly go beyond that. And for me, what integrative medicine means that, and I've done many things in my career, but one of the things I've realized is that this shouldn't be in a concierge practice where patients pay 10,000 a year to participate, or, isolated outside of the system with 20 pages of labs. It needs to be embedded within the work that we do. And that truly is a definition of integrative medicine, is that it fits into the work that we do, irregardless of where we're at. In modern medicine, it's very unfortunate for me that our work as doctors oftentimes is whittled down to a prescription. And I don't know if others feel like this. We certainly receive alumni every year that come through our program, and there is this common sentiment that our time with patients is reduced, and it is common that 72% of our visits are going to end in a prescription. Oftentimes, that's also what the patient expects on their end, because that's what they've come to expect of us. And our goal is to change that. And the truth be told, I've long thought about this, is, there's 8,760 hours in a year. And this is kind of the telltale story of a primary physician, as I see you for an annual visit. And I often tell you, you should exercise more and probably eat better. And, oh, you should get a little bit more sleep. And I'll see you in a year. And if I'm lucky, I have 30 minutes to do that with you. And it's unrealistic for us to truly believe that that's going to have an impact on our patients in the areas that I'm hoping, right, that we're hoping in integrative medicine to impact, which means we need to start looking outside the box. This is a fascinating, very old study on the ecology of medical care. And for me, it just reflects as well that 1,000 people, right, in our community that have symptoms, of those 1,000, less than one will make it to our academic medical center. And this is a reflection on oftentimes why we are so intense in our treatment of patients. In our training, right, this is that less than 1% that we're going to see at the hospital, oftentimes on the brink of death, very severe disease, and we need to throw the kitchen sink at them. What happens with our training is far too often this then gets extrapolated to everyone that comes through our doors. And not everyone needs the same treatment that less than 1% needs. And we don't wait, for people to fall off the cliff. We try to build fences at the top. And we've all talked about this many times, but we can't just speak to it. We need to really put this into practice. And this is where early in my career, I really found and read through the teachings of Dr. Weil, and has influenced me very deeply. And one of those paradigm shifts is that our bodies have the ability to heal. This is what should be emphasized in education for all people, and certainly in education of health professionals. And unfortunately, most people have no confidence in the body's healing ability. I'm well aware this is a tricky double-edged sword, that someone can feel guilty for their disease just because they didn't meditate enough. And we have to be careful to walk that path, yet to not give due credit and reinforce the tremendous ability for the body to heal, for me, is doing a disservice to our patients. And what I love about this is over time, we're only seeing a double down of the research that supports this. This is so far from fringe. Following a healthy lifestyle, and if we define that, it's pretty simple. Some form of stress reduction technique, active lifestyle, plant-forward diet, adequate sleep, and reducing vices. 80% of coronary artery disease could prevent, 50% of ischemic strokes, 80% of sudden cardiac deaths, 72% of premature deaths related to heart disease. These are extremely significant numbers. And this is really gaining national attention. We recently hosted the previous director of NCCIH, that's the branch of NIH that does focus on integrative medicine, Dr. Elaine Langevin. And she allowed me to borrow that diagram in the bottom right, where we're talking about this on a national scale. Even our colleagues at AAFP, I recently attended a gathering in Washington, D.C., where we're starting to speak in national organizations about a shift towards whole person care. This is whole person, not disease-centered. This integrates mind, body, spirit, and community. This prioritizes purpose, not only with clinical practice, but with research and education as well. And this advances connection and well-being. And I oftentimes get the criticism, oh, there's a wellness industry, or that's not the job for physicians. Our job is to focus on disease. My counter to that is, yes, there's a $5.6 trillion wellness industry where many of our patients are scrolling their Instagram, looking at their TikTok, and getting these answers. And 85% of these are influencer posts that are misleading, that are risky, that are spreading fear, that are selling some unverified supplement, and sometimes even promoting anti-vaccine information. This is not a job to be relegated to influencers on Instagram and social media. This is something that we need to be taking up as physicians, as those on the front lines of healthcare. And let's face it, our society is stacked against us. Our society is not designed for health. Sweetened beverages, screen time. I'm sitting as I'm giving you this lecture. Lots of stress, go, 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 and market increase in ultra-processed foods. The antidotes to those are accepted in circles, but they're not the prominent path for most of us in society. It's not the easiest choice in the lives that we live every day. And so we need to find ways to integrate these more into our everyday lives. And within integrative medicine, we've created 7 domains. And when I speak to patients about integrative medicine, as I've done for over 20 years, I will never cover all 7 domains. Just like a prescription for anything else that we offer, we try to find that domain or that area where a patient might improve their health the most by improving that domain. But it also gives us a story to tell. It gives a story that I oftentimes share with patients, is that our bodies have this amazing ability to heal. And I will say that the vast majority of patients will connect with that story. And I relate to them that when we focus on these 7 core tenets, it really improves our body's not only ability to heal, but to stay healthy. It will augment any intervention, anything that I offer for you as a family physician, anything that any of the specialists I send to you to will offer you will be augmented by supporting these 7 areas of stress and resilience, movement, sleep, relationships, nutrition, spirituality, and nature and the air we breathe. And I wanted to just go through, again, this practical side, and I call them integrations, is how do we take these vague, big groups and actually bring them to a doctor visit? One is to truly believe that they do have an impact. And again, maybe cherry picked some of my literature here to support some of my points, as we all tend to do. But those who cultivate resilience live on average a decade longer than those who don't. And for me, this has just always been so fascinating for me. And the literature widely accepts that on the front lines of healthcare, 70 to 90% of what I see, the upstream etiology will be stress. And yet less than 3% of our office visits include some form of stress management counseling. How can that be? Are we, that short-sighted that we're unwilling to go upstream to that common denominator to at least address it in some way? And again, the literature on this is just remarkable once you delve into it. This was very recent, 2025. This is a systematic review, meta-analysis, 1,670 menopausal women, evidence-based benefits of mindfulness, improving sleep, anxiety, depression. Think of any patients that might benefit from improvement in those areas, reducing perceived stress, enhancing quality of life. This is a brief 8 to 12-week program with a 6% dropout rate. And again, I'm going to come over and over again as an adjunct to our standard. We're talking 10 minutes a day. These are small doses that add up and make a huge difference. And these are things I've long incorporated in my practice: a 4-7-8 breath, gratitude journaling, cognitive reframing, laughter, and fun. I have a prescription for humor with my favorite joke. I won't share it with you guys today because I might get the tomatoes that I was promised I wouldn't. MBSR. Have prescriptions ready for each and every one of these that you can be as prescriptive as we would be with an antidepressant, with an antihypertensive, that we know exactly what remedy we're asking the patient to utilize, how often they should utilize it, in what dose, and to encourage that. Movement. We'll switch to another pillar. For most people, in most situations, exercise is better than medicine. Reduces mortality by up to 35%. Again, I don't think anyone on this call would argue with me that movement is a bad thing for our health. I think, again, The more important thing is to be able to speak to it with our patients in ways that it can really impact our health. Movement in cancer. This was just a really fascinating study in the challenge study in 2025, lowering recurrence and mortality in colon cancer very significantly by 29 and 37% simply by increasing our movement. Improved quality of life, reduced cachexia, improved treatment tolerance. Until we have a drug, and there are those attempting to mimic exercise in a drug in the IC7FC, these designer chimeric cytokines. Until we have that drug, we need to find ways that we're engaging patients where they're at to improve their movement. I'm a huge fan of Qigong. I oftentimes recommend for patients here in Arizona, there's a free class online through our public library that doesn't cost a penny. Walking, some of the better literature right now is even showcasing that as little as 5,000 to 7,000 steps a day, ideally after your biggest meal. Strength training, yoga, tai chi, dance, HIIT. Have that prescription, your exercise prescription ready for the patients. Sleep, I think sleep is the sleeper. I think we're going to be hearing so much about this in the next 5 years, and especially, again, going back to my many years of work in New York City, we often prided ourselves on sleeping so little. Fewer than 3 in 10 of us have restorative sleep. And insufficient sleep is a better predictor of chronic conditions, obesity, hypertension, coronary artery disease, than smoking, alcohol, and a lack of exercise. Something as simple as keeping our bedtimes and wake times consistent. Weekends too can reduce all-cause mortality from 20 to 48%, can lower our risk of cancer mortality by 16 to 39%, can lower the risk of cardiometabolic mortality from 22 to 57%. Something as simple as encouraging a patient to keep those times consistent of going to bed and waking up. And it's a Goldilocks phenomenon, right? As we should be really encouraging our patients to avoid those extremes. Short sleep in menopause increases depression. Long sleep greatly increases depression. 5 hours raises coronary risk by 92%. That 7 to 8 hour window, right? Again, not for everyone, but across the board, really encouraging patients to get well rested, 7 to 8 hour interval. Screens off an hour before bed, a cool, dark room, that bedtime routine. CBTI, by far the best proven treatment that we have for insomnia, and an herbal medicine. And again, this could be debated, but I stand by valerian. Valerian root, improving my sleep quality, reducing time to fall asleep. And I'll speak a little bit about a clinical trial that we're launching right now, where each patient gets a wearable device. We follow with validated measures. We're going to do a modified Delphi to try to identify the best integrative interventions for sleep. And my own data will feed back to my interventions to really reinforce whether they work or not. And as part of this, I trialed our software and used valerian myself. 2 weeks on, 2 weeks off, saw a decrease in my sleep latency, improvement in my overall sleep architecture. The proof is in the pudding, especially when it's N of 1, when it's my own data. Social connection is not a soft skill. It's an absolute lifeline. Social isolation increased the risk of early death by 26%. Again, rivaling obesity and activity. We are in a disconnected world, and we all know what COVID did to that. We launched a recent program for our students at Campus Health, and that includes our undergraduate and our medical students. It was called at the time Art Pharmacy, and now it's called Social RX. This is a fascinating program that really looks at the art activities both on campus and off campus. And when students come into Campus Health and screen positive for PHQ-9, GAD7, social isolation, they are given the opportunity to participate in this program. That means they are paired according to their interests with an activity. What's been shown even early on in the data is an experiential activity is most impactful of something they enjoy doing in the arts. They're also given a free pass for a friend or a colleague to go with them. And we're looking at social prescribing very closely under the lens of rigorous research to see how closely this can potentially impact depression, anxiety, social isolation. And again, it can be an adjunct to our pharmacotherapy. This is an easy add-on. Our quick integrations, phone time with a loved one, walk and talk meetings at work, cook and share a meal, volunteer. get a little bit more active in your community, join a meetup, have these prescriptions ready for your patients. Nutrition. 1 in 5 lives could be saved by changing what we eat. Just the number one cause of disease worldwide. And it's fascinating. And I realize oftentimes we work in food deserts, and there are other challenges that prevent our patients from choosing healthier meals. But that doesn't give us an excuse for not attempting in our best ways to address that. Ultra processed food consumption has just skyrocketed. And Michael Pollan has sage advice. Eat food, not too much, mostly plants. How do we find ways, right, even in the challenging context in which we practice, to really make this a priority for patients? Knowing simple things like skipping the walls of the grocery store, really, or skipping the inside of the grocery store and really shopping the walls. That's where your healthy foods will be. Avoiding the unprocessed foods. Look at that ingredient label. Fewer ingredients, better choices. Every meal, attempting to eat the rainbow. Fruit Loops doesn't count. And increasing that fruit and vegetable intake. Grown herbs on a windsill count. I had a patient in the Bronx, severe CRPS, one of the most severe cases of chronic pain that I'd ever seen in my career. Her and her husband grew on a 14th floor balcony in the Bronx, their own garden, and started eating their own vegetables. And she turned around. It wasn't just the vegetable intake that turned around, but was on the brink of suicidality and really took control of her life back. Part of that were growing herbs on her balcony in the Bronx. Air pollution, now the second leading cause of death worldwide, again, linked to 8.1 million deaths. This is a little bit more challenging for us. This is, knowing the things that we can impact and those that are a little bit harder for us. But I really, truly believe as frontline workers in the healthcare community, we need to speak to environment and the importance of that. Also, we speak to environment in terms of, topical products and the chemicals that might be going in our products through that. Nature and the air we breathe can be a little bit more challenging in Manhattan, but there are green spaces. I would often times give my patients a prescription to find them whenever possible and spend some time there, 15 to 30 minutes. Putting your feet on natural ground, watching the sky. The Awe Collective is a really fun project that was put together by a colleague here in Arizona, where you watch a sunset. You may be watching a sunrise. You may go out and see the stars at night. And you actually chart your awe. You get to put your location, you get to put what's happening, you get to read what others are doing to stimulate awe in their life. We offer here at the College of Medicine Tucson the Healer's Art. And I am tasked with giving the lecture on awe every year to our medical students. And I think this is such an underutilized, extremely powerful force along with meaning, purpose, and spirituality. And I think too often this gets the short end of the stick. We don't have time for this, right? We don't want to open this Pandora box, or again, oftentimes relegate it to religious officials. But looking at this literature, and I recently attended a convening on meaning, purpose, and spirituality with colleagues in lifestyle medicine, and it blew my mind that I hope that you can see this graph on the right, but the x-axis here is reduction in mortality, with 20% being 20 to 25% being that middle range. And then we list up there, physical activity is at the top, makes sense, right? That physical activity will have an impact on reducing mortality. Tobacco cessation is right behind that. Fruit and vegetable consumption, pretty close. But in red there, church and service attendance, active religious involvement, religiosity and spirituality, all in the double digits. How impactful this can be for overall mortality, yet most of us, myself included, just didn't pay attention to it for a long time. And again, these are things, and I recently have been on another kick of Dr. Viktor Frankl and a lot of the messaging that he shares, and finding ways to weave this into our everyday practice, I find can be extremely helpful. Sometimes, and again, it really shouldn't just be these patients, but those patients that you might see on your schedule for that day of your heart sinks and things are challenging. Let's not try that same old path that we always do of medication compliance, or whatever we've done before. Perhaps it's time to take a step back and approach from a different angle, and delve into the meaning and the purpose, and do they have a connection, a spiritual connection? Do they have a connection to something greater to themselves? And attending a religious or spiritual gathering, it's commonplace that I will reconnect to someone or a patient to something they previously did, and we'll set that as a SMART goal just to show up to church, to service, to a congregation. Engaging in personal prayer. What a remarkable way to address stress, as we spoke to earlier, that for many of our patients really resonates deeply with them. Reading sacred texts, meditation with intention, and again, back to nature. For many patients, nature is their spirituality. Spirituality in advanced cancer, a key randomized controlled trial. We had meaning-centered group therapy versus just standard support. Advanced cancer patients, we saw an increase in their spiritual well-being, an increase in their sense of meaning, an increase in their quality of life, a decrease in despair and hopelessness. This is evidence-based work that we do, and it shouldn't just be end of life and advanced cancer. This should be something that we utilize with all our patients. And the other criticism I hear quite a bit is, oh, again, what difference does this make, right? It's our evidence-based therapies or our pharmaceutical interventions that really have the biggest change in our patients. And I completely disagree with that. Number one is I think a lot of integrative interventions truly empower a patient. Most of what we do in medicine, we do to the patient. They lose autonomy. They lose the ability to be advocates for themselves. And integrative medicine really digs deep, and a patient is in charge. And again, not from a guilt perspective, from an empowering perspective. And this is a recent study that I found very fascinating. 2026 published how tiny changes can make significant differences. 5 extra minutes of sleep a day added a year onto lifespan, right? Not health span, lifespan, but impacting mortality. 2 more active minutes per day, a year onto lifespan. Better quality diet, an extra single serving of vegetables per day, added a year. Bigger changes linked to 9 years. That's when we start to stack these. When we start to look to 7 core domains, we see compounding interest on lifestyle and integrative interventions. This is very powerful for me. And this was, for me, the big shift. Most of my training set me up to be the mechanic. You have hypertension, I have an antihypertensive. You have reflux, I have an anti-GERD. You have depression, I have an antidepressant that I can prescribe to you. I am grateful. I am grateful for all of those things. But the human body is more than a machine, right? The human body is incredibly complex. And if we were to give it a fair analogy, it's much more like a garden. Give it right conditions, right? Support those right conditions, and it can and likely will flourish. That doesn't always mean cure. That may mean healing, but we don't speak to this enough. What are those right conditions, for the human being to thrive? We believe those are the 7 core tenets of integrative medicine, and that healing does come from within, and that the patients should participate in an empowered way, not a guilt-driven way, an empowered way as gardeners in the ecosystem of their own health. And switching gears here a little bit, I'm also a huge fan of technology, and for some people this is a little bit paradoxical. Here many of what we are speaking to in integrative medicine date back thousands of years. I think this combination of sun and moon is really going to be remarkable in the next year. And I spoke a little bit to wearables that can empower us in some of these lifestyle modifications, which are difficult. Behavior change is not easy. I think for some subset of our patients, that data will empower them. It does for me. And this new era of personalized medicine that is going to be enabled by continuous health monitoring is going to allow us to move upstream from this kind of reactive whack-a-mole medicine that the patient with hypertension will be automated through AI in the near future. They're going to know exactly what that blood pressure has been, exactly the best antihypertensive, when to take it, and how to titrate that will be automated in the near future. It's going to be the relationship and the approach to many of the things that I discussed, including meaning and purpose, and the oversight of that data, which will be our role as physicians. And artificial intelligence, as we're all seeing on an everyday basis, will absolutely revolutionize the work we do. We need to utilize that to our advantage, which means building those fences up top. It's going to allow us the freedom and the space to move upstream. I realize maybe that's wishful thinking. I truly believe it. I have an AI scribe in my everyday work as a physician in Arizona. It allows me to look into the eyes of my patients again. I am not focused on my laptop and my keyboard. Wearable devices are again, everything from heart rate variability to monitoring sleep latency to you name it. I was interviewed as a chief medical officer for a smart toilet. And they exist now, looking at your stool and giving you a Bristol rating and telling you probably more about your health than you ever wanted to know through your toilet seat. Virtual consultations and democratized health information. As we see more and more, this information is reaching our patients. We added, I think I may have a slide about this, but we added an AI chatbot to our peer-reviewed literature that support integrative oncology, and patients can now go to our website and ask questions about integrative oncology approaches to our chatbot that's fed only by our peer-reviewed literature. It's not a World Wide Web feed. And systems-based thinking. This is a shift I think we long embrace in family medicine, and I'm excited for us as well. This is actually the tool I was speaking to, the Can Heal Cancer, that we did in conjunction with our Eller College of Management, that in the bottom right is now an AI chatbot. Rather than clicking in and following hyperlinks to learn more information about an anti-inflammatory diet or how exercise can decrease recurrence of specific cancers, you can ask the chatbot and it will answer you only based on the literature that we've reviewed. And for me, this is just a big topic, right? That I think that we haven't spoken to enough. And again, even back in medical school, for me, there wasn't much differentiation of a calorie from a potato chip and a calorie from broccoli. And we now understand extremely well that these are two very different calories related to our health, mostly due to the phytoconstituents, the phytochemicals that come along with that broccoli that aren't present in the potato chip or the gummy bear. I really think that we're going to start looking at medicine in this way as well, and the complexity of the human being, and having better tools at looking at the bigger picture. This is an excerpt from a book chapter I wrote on the endocannabinoid system. It's as recent as the 1980s that this entire system within our human body was discovered. This is a ubiquitous system that oversees homeostatic modulation in the human body. It's a remarkable system that, again, we didn't know until the early 80s. And we still really don't study it that much because of the stigma that surrounds cannabis. And yet it's a system that oversees some of the most important factors, from sleep to stress resilience in our body. It's the most ubiquitous G-coupled protein receptor in our brain, and we know extremely little about it. That's the CB1 receptor of the endocannabinoid system. And we're going to have opportunities to scale this. I hope you guys are exploring, if you're not doing already, shared medical appointments. This is a way where we can share this information with a group. We can speak to this information. We can solidify even behavioral changes within a group. Community empowerment, and I know that this is a part of all of our training. Our division is within the Department of Family and Community Medicine. We need to empower our communities even more. They are the crucible whereby these changes will happen. I really spoke a little bit to the digital health and how that's going to change, and we're already seeing EMR and integration. My colleagues in lifestyle medicine have made this a part of EPIC. I think that you guys are on the EPIC system, where you can really see lifestyle medicine embedded in the questions that we ask our patients and in documentation. This is just the tip of the iceberg as we move more in this direction. Dr. Jesse Pines is one of our 2,500 graduates from our fellowship, and recently published this in Forbes. There are foci for integrative medicine where we're really going to make a difference. Chronic pain, autoimmune disorders, cancer treatment and survivors, anxiety, depression, and PTSD, IBS and digestive disorders. Each one of these realms truly demand an integrative approach. And integrative medicine, and this is the whole point, right? This was the vision of Dr. Weil back in the day. This is no different from any other medicine that we practice. And we should be addressing fears. We should be discussing efficacy. We should be highlighting harms. We should be considering costs. We should be advocating for our patients. We should encourage surveillance of the interventions that we often offer in integrative medicine, just like any other intervention that we offer through our board certification, through our usual training. And it is the work of these two hand in hand that I truly believe and have witnessed throughout my career that it's going to offer the best outcomes to our patients. And for those of you that don't know, this is our center. Started as a very humble trailer off campus, and we now have a $23 million amazing building that the 7 core tenets, thanks to Dr. Esther Sternberg, our previous director of research, are embedded within the building. Those same 7 core tenets of integrated medicine that we try to bring in integrations to the patients, we build within the built environment of the place where we work. And we speak to others to try to do the same. We're a rebel with a cause, founded in 1994 by Dr. Andrew Weil. We're driven by the mission. And that mission is to transform healthcare, is to widen the aperture, is to include many of the things that I discussed with you today, and purposeful placement. We're the first dedicated academic integrative medicine center established in the heart of a major university, fully recognized, fully integrated, actively shaping the future of healthcare. We have a seat at the table at the Dean's Council. We are a part of the healthcare system and want to make sure that we're an invaluable part and that our voice is heard. And this is, again, our fellowship has evolved over time. I know that the IMR is embedded within the training at IFH, and I'm very, very pleased to hear that. As the director of the Andrew Weil Center, I am here to support that in any way I can, and want to make sure everyone is aware of our fellowship. And integrative medicine here, and I want everyone to walk away with the definition from Dr. Weil. It's the medicine of the future. It's simply good medicine. It takes into account whole person, all aspects of lifestyle. It emphasizes the therapeutic relationship between practitioner and patient. It's informed by evidence and makes use of all appropriate therapies. And we are not only the fellowship, as I mentioned, the IMR, we also have iHelp. This is our allied health professionals. About 30% of those are nurses that include psychologists. This really is the realm of our support network in the front lines of health care. Integrative medicine and research. We just announced a very strong collaboration with our College of Public Health. Public health and integrative medicine walk hand in hand. You'll be seeing much more in terms of outcome research from us at the center, and integrative medicine and clinical practice. We have a clinic in conjunction with Banner Health. It's the 5th largest nonprofit in the United States. We have a clinic on the northeast side of Tucson where I still see patients as the director and as an integrative physician. And with that, I think I finished a little bit early here, which is fantastic, because then I hope that there are some questions that we can speak a little bit back and forth.
Thanks, Steve. I'm so proud of you. I think this is my fantasy of exactly what you're talking about, embedding integrative medicine in primary care. One comment I would have is a lot of this starts with ourselves. And, the stress of your work extending into your home life, the demand to see patients at a rapid pace. What would you recommend we do as providers for ourselves to help implement what you're talking about?
Oh, you came at me hard right away with a tough one. There's no easy answer to that. We all know that. And again, I've already mentioned I wear another hat as the Assistant Dean of Wellness. And one of the first things we'll hear as we pull, thousands of employees across the system, don't give me another meditation class. I got too much on my plate already. Let's really be frank about that. And I think it's a very honest question. And I can speak to, again, some of the literature and even more importantly, my own life. If I practice a 4-7-8 with a patient, my stress level just went from skyrocketing to a baseline that we need to embed. And oftentimes early in my career, I'm like, oh, I'm wasting a patient's time. They have a long wait time to come and see me, and they want this new miracle drug or whatever it is. And I shouldn't be spending that time on a 4-7-8, and just time after time again, me practicing that with them, showcasing that I know how to do it and that's embedded in my own life, not only teaches them something that they can walk away with, and that we don't develop tolerance to, becomes more and more powerful for them. Even more importantly, allows me just a breath in that crazy busy day. And I wish I had a better answer than that, but we have to really do practice what we preach. We have to embed it even within our busy day. And we have to conspire together. And Dr. Weil likes that word because it literally means to breathe together. But, we need to fight for defending, right? That we need time with patients, and that's where I'm very excited. For the first time in the history of the center, in June, we're going to Washington, D.C. to speak to integrative medicine and the power of it, not only to look for reimbursement for the work we do, but to speak to changing billing codes and how we're reimbursed for this is a longer fight, but we can't give it up. We need to constantly discuss, with the powers that be, that this demands the reimbursement that we should get to be able to spend time with patients. And those are superficial answers, Red, but we need to embed it in our own lives, not only outside the clinic, but even within the clinic. That means even a break with our colleagues, maybe not bringing that cake as much as we all like it to that celebration. And, even at the center, it feels like we're drinking the Kool-Aid, but we'll do a short breathing exercise or a centering meditation, which feels weird the first time you're doing it. As you get into it, you realize this is what grounds me for this difficult day or this difficult afternoon that's ahead of me.
I completely agree with you. I think you really change the whole dynamic when you just sit quietly with a patient and what you do for yourself. And one place that Nicole Nurse, our chief human resources officer, just mentioned the idea of at morning huddles. That's another time when the team is together to just take a moment and say, breathe. So I think it's a really helpful point.
Yeah, there's some real, just to piggyback on that a bit, again, we have two applications we're trying to put in for this Maha Elevate grant. One of them, I'm actually as a consultant for an organization called Healing Breaths. I met them early on as a director. I said, hey, I want to do the largest clinical trial on breath work ever done. And then I was surprised. And this is what I think the beauty of integrative medicine too, is if you start searching, it's remarkable the literature and the projects that exist out there. And really what they're showcasing, the power of breath work is remarkable. And I think we're hearing more about that. But even like a simple intervention like that is not fluff. It's not fringe. And the more that each and every one of us can embed it in our everyday life, it's very powerful. And the science supports that. And we hope, right, that there's $3 million in a grant that can further support that and find ways for it to be embedded in our everyday practice. That means giving our patients a great resource in our limited time to run parallel to our clinical visit to explore this more. And that's one of the things we're also working at the center. That short clinical visit can plant the seed. We need something that then follows that up to really embed it in our patients' lives.
There's an additional question about the importance of alcohol, where alcohol, I guess, sort of fits in as something, for some people can be very soothing. Other people, it's a real poison.
Yeah, I think that's a fantastic question. I'll give you a couple updates from the center. Dr. Weil has an award-winning anti-inflammatory diet. It's based on the Mediterranean diet. He very recently publicly made the move to remove alcohol from that. I think with some of the most recent evidence, we're really just seeing even that occasional glass is not beneficial. And this is still debatable. We've seen it flip-flop far too many times. I would say first and foremost, not bringing guilt to the table, right, with our patients is that's not a good approach. And what I oftentimes lead with, and I will say that this same experiment I did with valerian, I looked at the impact of even a glass or two glasses of wine on my deep sleep. And I probably had to do it about 10 times for me to give up alcohol. I'm half Hungarian. We wake up with schnapps with my relatives in Hungary. I did school at the University of Wisconsin-Madison, probably the biggest drinking school. You talk about a substance that's accepted and actually a go-to, an amazing social lubricant. It was embedded within my own DNA and fabric as a person. But these things encourage me to get to the point of it's not worth it. The next day, how I feel, if I can share that with a patient and I'm modeling again what I'm asking them to do, that can be very powerful. So we're actually calling for the complete removal of it gently without eliciting guilt. Again, I think moderate to smaller amounts. I do think is not going to have a tremendous negative impact. And again, it's the crutch oftentimes because we're less than 3% of our patients are walking out the door with a different way to approach the remarkable stress we all face on a daily life. Will they substitute with a breathing exercise? Probably not. Can I plant the seed that breathing exercise or that intervention for stress grows to a point where they need less? I fully believe that. We need to give them other tools. Alcohol, it's cheap, it's easy, it's accepted, which is why we go to it. It is the easiest choice to deal with that on a very quick basis, and the compounding effects of that are negative. We've all seen it.
Here's another question from one of our behavioral health faculty. Would you please share again the slide on the conditions that integrative medicine really helps with? Really appreciate your work in talk as a psychologist. All of us, and not just our patients, need and deserve an integrative approach to health. So, I guess
Is that Dr. Alfasi? Am I under the gun here?
No, it's one of
All,
our
all my
colleagues.
slides, I share them I share them widely. So again, whoever I need to, I'm happy
Yeah,
to
you
share
can
all
send
these
it to
slides.
us and then we'll.
Yeah, no, and I want everyone to have access.
Yeah,
We're open source, and just really this is information we want to be out there. I think it was even recorded potentially for YouTube
Right.
as well. And again, if you see a citation that you disagree with, write me directly. I'm constantly refining it, but I try to keep on top of all of them.
Let's see. Here's one from our colleague, Dr. Nozel. Dr. Dahmer, you totally rock. So proud to have you in this role as family physician leader. Sarah, as you may know, is president of the AAFP this year and is just doing amazing work in that leadership role.
Talk about a rock star. I mean,
Yeah,
if I had
yeah,
known that she was
and
on, I probably would have been more nervous for this talk. I felt a little robotic on it, Red. I think it's because it's 5 a.m. here,
yeah, well,
but Sarah, thank you, and you are doing such amazing work. We're all so proud of you, and I follow Dr. Noso very closely in the remarkable work she's doing on not just a national and international scale. Really incredible. Speaks to IFH, Red. Speaks to the work that
yeah,
you've done and everything about the organization.
yeah, well, thanks, Steve. That's really great. This is from Sarah Karp, one of our faculty. Our primary care visits have gotten progressively shorter. Annual exams are 15 minutes. We are reimbursed on a volume model. How do we shift this paradigm? Well, I guess one thing is you said go to Washington.
Well, I think all of us at least should have it on our radar, right? I think the worst thing we can do, and this is true of integrative medicine, is to try to ignore it, not to try, but to ignore it, sometimes out of giving up completely. And I'm not saying anyone on this call is doing that, but let's all like have some vision to that. I had to fight tooth and nail for this 101 in Washington, D.C. I knocked on our government relations team on their door probably 15 times with no answer. When they finally answered, and now I have a beautiful $20 million center, I brought them there. They said, we can't believe the work you're doing. How did we not know about this? And little doors start to open where these things change. And I would just say that. And I would also, I am a big fan of the shared medical visit, the group visits. There's remarkable resources out there. I am affiliated with Ardmore Institute of Health. If you don't know their Full Plate Living, they offer shared medical visits, free resources, PowerPoints online, tee us up on how to do that. It's a fun, different approach to our, patient after one, after another, after another, after another. We're behind. Oh my gosh, we've got to catch up. This one, it's a group of 8, 10, 12, right, to really meet our RVUs. Can get more of that depending on how good our marketing is or that word of mouth. And you're sharing that same message with that group. And then there's banter back and forth, which is remarkable to witness. And it's a great approach that the major hospital systems are embracing because you can bill for this now. Even within Medicare, there are billing codes for group visits and shared medical appointments. I first saw a group visit in the favelas of Brazil with a Brazilian psychiatrist that had a line of 150 people at his front door because he gave a psychiatric care for free in the favela. And he instituted shared medical appointments in the favela with sometimes groups of 100. And I would sit next to him and he would turn to me and he'd say, look, they're solving one another's problems. And this is the best approach to healthcare that I've ever witnessed in my entire career. And that was in 1999. So it dates my age a little bit, but it was the first time I saw it. And I think they're extremely powerful and underutilized and can be built.
Right. And that's just to emphasize how the community itself can support each other and share, because that's where you get into the issue of social isolation and, relationships that can be healing. So that's a good point. Thank you.
No, and I think sometimes I like to say, again, we call them side benefits. And that's what I like about integrative medicine so often is that, we're speaking to cholesterol or mind-body interactions in that shared medical appointment. But as you hit the nail on the head, Red, it's the social interaction, as we saw from some of the data, that might be the most powerful aspect of that. And we don't know. It's multifold, these things that are coming together that can improve overall health.
Another question from our behavioral science faculty, Warren J.M. You encourage spirituality. This is a political decision to encourage participation in groups that seek solace in the metaphysical. Is there medical value in encouraging patients to get involved in changing the society? Is making them sick?
Hmm. I'll give a little a spoiler alert. So I'm preparing. I've been accepted, I think, out of 150 to give a TEDx talk in Bend, Oregon. The title of my talk is Rebel Health, and to be healthy in our society requires an act of rebellion. And that speaks to that slide where we have sit culture, go, 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 stress, 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 ultra processed foods. All the sick enabling choices are the easiest choices in our society. And to be frank, it's probably dating back to Goldie and others that you need a little motivation, which for me is sometimes rebellion, to say, no, I'm not giving you my money to make me unhealthy. So wish me luck, and if I'm successful, you'll hear more about that.
Oh, that's great. Congratulations.
But so the answer to the question is yes. And again, is it on a large level where there's a law against supersized drinks or smoking, right, in public areas? Yeah, absolutely. Is it on a personal level, even more importantly, that we're making these decisions where our greatest power is in those 8,760 hours outside of my clinic room? That is where our true power lies.
Yeah, no, I agree. Um, see this.
I think Dr. Lurio's question is the only one we haven't gotten to, Dr. Schiller. And I can read that out if you want me to.
Yeah, would you?
Yeah.
Because I'm in between chat and QA and
Yeah, a lot of engagement. So
Yeah.
wonderful. Thank you, everybody. And thank you, Dr. Dahmer. Dr. Lurio asks, can you respond to the issue of the risk of elitism, where spending more time with individuals reduces access to others? Instead of doing breathing exercises with our patients during an encounter, perhaps we should have someone conducting this with patients in the waiting room. It's a suggestion.
Yeah, no, I completely agree. And that's the direction that we have to move. And I appreciate the question, Dr. Lurio. And again, I've even guilty myself. I worked in Scarsdale, New York in a concierge medical practice. I've done everything across the board, direct primary care, again, FQHC, my training. And this is the whole goal and why I came back to integrative medicine. These interventions are not expensive. This is not something that breaks the bank. This should not be for, the elite few. We should not be doing, $2,000 worth of lab testing on some and not having time for breathing exercises for others. And that's why I came back to actually take this role, which was a big change in my own life, is because it should be embedded within the system. And as I spoke to before, we're really trying to find ways. And I mentioned kind of the healing breaths, which is going after the Maha Elevate. We're supporting one of our alumni is doing an IBS study. We're working on the sleep study. That these things should not be costly. They can run in parallel to the work that we're doing, and it should get to a point where the breathing exercises is just for my own benefit. Because there are so many resources for my patients to be able to access that outside of my visit that I shouldn't even have to spend that time. And I would do that only because I need relaxation myself. But that's not the current state of reality. And oftentimes I still find that irregardless of the background of that patient, that breathing exercise is probably what they need the most and could benefit them the most. But we're constantly thinking about how this isn't just for the elite, how this isn't just even a direct primary care or a concierge model, that this is embedded within the systems by which we serve patients, the insurance that they have, and for those that don't have insurance, still accessible. And it's a bigger challenge. It's a bigger fight that I've been thinking about for 20 plus years. But it is high on the list for us to explore. And there is an organization which I was lucky enough to give a keynote at this past year at their conference, I Am For Us, Integrative Medicine for the Underserved. It is a remarkable organization that focused on this and speaks to how the 90% of what I discussed, 95% of what I discussed doesn't require money. Probably the organic produce, the highest, and that's also something we're trying to address. And maybe I'll just give one other shout out. I know we're at the end of time, but thinking outside the box, one of our graduates, Dr. Stephen Chen, has an organization called Recipe for Life. It's in Alameda County in California. I think it's second most diverse to Queens in the United States. And BIPOC farmers grow regenerative food that's delivered to the door of those in housing deserts. YMCA health coaches, and we just had Elizabeth Markle as a keynote speaker at our conference, then supports patients with culturally appropriate recipes, a lot of these 7 pillars of integrative medicine, and all of that circles back to the clinic that can then charge for it. So there are really mechanisms by which this becomes embedded in some of the most medically underserved communities. And really, these are still snippets and should be across the board, but I see tremendous potential to adopt more of this, especially in those settings where there are medically underserved.
Yeah.
I hope that answered the question, Dr. Lurie. It's a
Yeah.
tough one, but it is front and center and something I think about a lot.
Well, and I think what you've highlighted as a fact is that, there's work to be done in the exam room, and there's work to be done outside the exam in terms of, reimbursement and time and resources and all the things that you brought up.
Maybe just real one quick word is, the frank, honest truth too is our center runs on philanthropic support. And again, there is a part, even the Center for Health and Healing, where I did my fellowship. I mean, it really, and you can ask Ben, Dr. Kliegler, I said to him directly, I moved from the Center for Health and Healing to Iora Health, which was revolutionizing primary care for that same reason. We were serving more and more the affluent, and there's no fault to that. Sometimes it's finding a toe in the door to showcase that, we can practice this and gather the data that it's effective. But, again, we've been on that for far too long, and it needs to expand.
Right. Well, thank you, my friend.
Thank you.
Excellent talk. I can see the sun's coming up in your part of the world. So thanks again for joining us at such an early hour. It's great to see you.
It's an honor and a pleasure, Red. Thank you for all that you do in IFH, and what an honor to be a graduate and to call that home at one time. And thank you all for attending. And please don't hesitate to reach out. We're an open door, and we practice what we preach, and we really want this to grow more.
Thanks again.